Hi, do you ever get pain in your foot or in your Achilles tendon or lower back part of your shin when you're either walking or running? If so, this could be coming from the posterior tibialis muscle. Hi, welcome to the Body Shop Physical Therapy. I'm Dr. Catherine Price. I'm a physical therapist, and in this video, I'm going to go over trigger point release of the posterior tibialis muscle. This muscle is commonly associated with what you would refer to as posterior compartment syndrome or shin splints that are caused on the back side of that shin bone. Before I begin, I want to speak a word of life from Ephesians 2:8-9. For it is by grace you have been saved through faith. This is not from yourselves, it is the gift of God, not by works, so that no one can boast. So the posterior tibialis muscle is going to run deep in the back side of the shin bone. So we've got our shin. If some runners that will experience shin pain, it can be in the front side, and I'll go over that in another video, or it can be from the back muscle, which is the posterior tibialis, but it is going to be the deepest muscle. So it's underneath the calf, the soleus, and it's going to be in what you call that interosseous tissue. There's two bones. You've got your outside fibula, you've got your shin bone, your tibia, and it's deep in there. Now, when I point my foot down and inward, you can see this tendon here. That's going to be my posterior tibialis, and it's going to go deep back here behind that shin and attach into, if you can see that bone sticking out, that's my navicular bone, and it's going to attach there and across to the cuneiforms, which are going to be some of my midfoot bones, and then into the cuboid, which is going to be all on the outside right behind the fifth metatarsal. So my posterior tibialis is going to run from the back side of my shin down and underneath my medial malleoli, so that bone that sticks out on the inside of the ankle, and then crosses, attaches into the midfoot. So it's going to be responsible for creating the arch. So every time my foot pronates, that muscle is going to be controlled by the posterior tibialis muscle, and it's going to put some stress and strain on the tendon, and sometimes that can get inflamed. So the foot can be painful, or even the back side of the lower part of the leg. So pronation is going to be three parts. When you are running or walking and your foot contacts the ground, there is going to be what you call a subtalar eversion. So that's where the heel bone is just going to turn outwards, so to speak. And then I'm going to have a dorsiflexion, which is the foot is going to come up. And then my midfoot or my forefoot is going to slightly abduct or turn out. So it is a three-part component to that pronation. And that tendon is going to be underneath here, and that muscle running up here is going to control that pronation. So if I've got a hypermobile foot where I'm constantly pronating, that can create trigger points in the posterior tibialis muscle. So to release the trigger points, what I'm going to do is I'm going to use my thumb because it is so deep, and I'm just going to find my shin, and I'm going to go right as I'm going to push my gastroc as best I can away, and I'm going to work deep into that area, and I'm going to work my way down, kind of following that line where you can see in that ankle where the tendon is going to come down, and I will just work deep, deep, deep in that muscle. And if I find an area that's tender, I'm just going to hold there for about 20 seconds. And what I can do is while I'm holding, I can kind of point my foot down and in. So that is the action of the muscle. It's going to point the foot and turn it in. So it'll be stretched when the foot is turned out and the foot is flexed upward or dorsiflexed. And that's going to be part of stretching it. So I want to just work on applying pressure deep behind the shin bone, working my way down, and I'm going to be working towards my ankle. And I'll just work all of that area. If you're on an area where you are feel referred pain, sometimes you can feel and reproduce the pain that's being experienced when you're walking or running. So for the fascial and trigger points within the muscle, which are overcontracted areas in the muscle, I like to spend the minimum dose of 2 minutes just working on that muscle. If it's got trigger points and has a lot of areas that require the fascia and the muscle to be worked on, it may take a lot longer, just depending. So if you start to address those as soon as those pain patterns show up and you're finding trigger points, that may alleviate it. It's always great to have a physical therapist work with you and assess what's going on to determine the causative factors of the pain that you're experiencing. So after I have worked on the trigger points on my posterior tibialis muscle, I'm then going to stretch it. And to do that, I will extend the leg and I'm going to turn the foot out and pull the foot back towards me. So that is how I will stretch the posterior tib. Looking at this foot, so here, I'll turn the foot out and pull it up towards me. And if the flexibility to reach your foot is difficult, you can take a towel, place it over the forefoot. So you want to get to be able to pull the foot back into dorsiflexion. So I'm going to pull my foot back, but I'm going to pull more to turn that foot outward. So I'm going to evert my foot and hold that stretch anywhere from 30 seconds to a minute. You can do up to 3 repetitions. So continuing to go back and work on releasing the trigger points in my posterior tibialis muscle. Sometimes there's what you call a tiger tail, where you can work deeply along that back part of the shin bone, and that can help you to mobilize the fascia as well as the muscle. But to get into that muscle, you want to find it more, you want a narrow surface so your fingertips can apply that pressure. And it is a deep muscle, so I will use my fingertips to get into the posterior tibialis muscle. So I hope this is of help, and have a blessed day. Thank you.